5 super strange things that happen during your C-section from a labor and delivery nurse. Number 1, you might feel pulling, pressure, tugging, and movement on the other side of the drape, even if your anesthesia is working perfectly, especially in the moments right before your baby's delivered. And this can be very alarming for people because they tend to worry that maybe the anesthesia is wearing off, but the good news is this is completely normal and it is not an indication that the anesthesia is no longer working. What I always tell my patients is if they are definitely feeling pain or sharpness, not pressure, they need to let the anesthesiologist know right away because that is not normal. Number 2, you might notice a burning smell. That smell is from a tool being used to cauterize tissue during the procedure. It is not a pleasant smell. It may be alarming and strange, but it's completely normal. Number 3, you might start to feel really tired during the procedure or experience nausea and vomiting. In most cases, these are side effects from the anesthesia you're getting and are completely normal. I always tell my patients to let the anesthesiologist know of any symptoms that are developing. The anesthesiologist can decipher whether or not this is normal or if this is something more concerning. On top of that, the anesthesia oftentimes has medication they can give you to help reduce these symptoms and make you feel more comfortable during the procedure. Number 4, it is very bright in there. Now during the procedure, you're going to be positioned on your back and is in a little bit of a tilt to their left side with their arms out. You have the arms placed on boards. They're not strapped down where I work. Guess what? You are looking straight up at fluorescent lights. Now you can still move your head around, turn it side to side, lift it up and down, but for a lot of my patients, it's very surprising and unexpected how bright and lit up the room is. Meanwhile, dimming the lights can reduce stress and anxiety, and you are welcome to talk to your provider and see if this is something they can accommodate during the procedure because a lot of operating rooms have a lighting system that provides dimness and brightness in different parts of the room. At the end of the day, we want your team to be able to see and visualize everything really well because safety is going to be our top concern. But if there are ways to safely help you feel more comfortable during the procedure, like dimming the lights or playing music on your phone, ask your provider about it. Number 5, if you and your baby are stable, skin to skin and breastfeeding in the operating room is still on the table. Yes, pun intended. This is actually common practice in many hospitals, but in some facilities it's not, so talk to your provider if it's something you're interested in. While we know there's a lot of benefits to skin, if you're a person who does not want to do skin to skin, you're just not comfortable with it, that's okay. Just let your team know. You can have your partner do skin to skin with your baby if you're comfortable with that, or you can do skin to skin later when you're recovering. As a nurse, I always want to know my patients' preferences when it comes to skin and breastfeeding. For more information on pregnancy, birth, postpartum, babies, give me a follow, check out my page.